question. The member for Cambridge.
Thank you very much, Mr. Speaker, and good morning. My question is for the Minister of Health. Over the weekend, former employer of the Premier's Chief of Staff, the Toronto Sun tabloid, in an act of state propaganda, mischaracterized a letter signed by 2 government members as pushback against the Premier, when in fact it was written to the Chief Medical Officer of Health and not the Premier. It was another example of this government passing the buck. 6 weeks ago, during question period, I stood here and I asked the government for objective criteria and a framework. Why did the government refuse to publicly release transparent objective criteria prior to shutting down businesses in 4 regions across Ontario?
Minister of Health.
We have been very transparent with the information that we've published with respect to why some of these areas were put into modified stage 2. It depends on a number of factors, including the number of cases, of course, the ability of our public health system to be able to deal with that in terms of contact tracing, testing, isolating, and so on, the ability of our hospitals to be able to manage that excess capacity if we have an overrun of patients with COVID-19, and of course we consult with the medical officers of health in all of those areas. It's not just one person that makes this decision. It's Dr. Williams, it's the Public Health Measures Table, but it's also the medical officers of health in those particular areas. In the areas that are now in the modified stage 2, the local medical officers of health all agreed that this was necessary.
The supplementary question.
Thank you very much, Mr. Speaker. You know, this government continues to pass the buck. In one breath, they say they rely on medical experts and want the public to give them a pass on their botched use of emergency powers because they aren't doctors. In another breath, they threaten swift action and that they might bring down the hammer. But the Chief Medical Officer only provides recommendations. The decisions are supposed to be made by the Premier and this government. Are they making the decisions or not? Because if they're not making the decisions and don't want any of the criticism, perhaps they should let the Chief Medical Officer, who they like to blame, serve as First Minister and Minister of Health. So I repeat, is this government making the decisions or not?
Minister of Health.
Well, in every case, all of our decisions have been made based on scientific evidence and clinical evidence. I'm not sure, Speaker, I'll ask the member through you, who she would like us to rely on to make these decisions. We have to make decisions based on the scientific evidence, based on the recommendations of the medical officer of health, on the people on the health command table, on the people on the health measures table, by a number of doctors, physicians who have volunteered their time to serve, by the medical officers of health in all of the units. This isn't a single decision that's made by anybody. This is a decision that's made by the political advisors, by all of us as politicians, based on the recommendations of the medical officer of health and all of the other people that are giving us recommendations. That's what we should be making the decisions on. That's what the people of Ontario expect us to be relying upon.